Nigerian Center for Disease Control has announced that 8 new cases had been added to the number of COVID-19 cases in Nigeria. Of that number, 2 are in the Federal Capital Territory, Abuja, 4 in Oyo State, 1 in Kaduna, while the other one is in Osun State. This brings to 97 the number of confirmed coronavirus cases rising in Nigeria after 8 new cases were recorded yesterday. And staying with COVID-19, the governor of Kaduna State, Malam Nasir El-Rufai, has announced that he has tested positive for COVID-19. The governor made this known via his Twitter handle on Saturday, saying that he is currently in isolation. In a video attached to the tweet, Governor El-Rufai said his deputy governor is now in charge of the state task force on COVID-19.
Earlier this week, I submitted a sample for the COVID-19 test. The result came in this evening, and I regret to say that it is positive. According to the protocols for managing COVID-19, I'm in self-isolation as required by the case management guidelines issued by the Nigerian Center for Disease Control. That is for someone that is showing no symptoms. I wish to appeal to the people of Kaduna State to continue to closely observe the preventive measures already announced by our government. It is most important that everyone should do their utmost to stay safe, stay home, and stay alive. The Deputy Governor is in charge of our task force on COVID-19 and will continue to issue statements from time to time.
After the Kaduna State Governor made public his status, the Governor of Benue State, Mr. Samuel Otom, has appealed to residents of the state to avoid stigmatizing anyone diagnosed with the coronavirus disease. While briefing journalists in Kaduna, the Benue State capital, after receiving the results from the NCDC, Governor Samuel Otom said the case is a returnee from the United Kingdom. He called on the contacts of the first confirmed coronavirus case in the state to voluntarily make themselves available for isolation purposes.
We want to advise Benue people, no need to stigmatize anyone on this matter. This is a new virus that the whole world is battling to contend with, and so there is no need. We decided to call her name Susan Ope for people who came in contact with her in the last 14 days, so that you can come out and or do safe isolation, and where you have issues, you will please be required to call the numbers that we have given out, and specifically 091 860 2439. 091 8602 439 or 070 2503 1214.
Meanwhile, the president has received a briefing from the Minister of Health, Dr. Osage Eranire, on the efforts being made to curb the spread of coronavirus in the country. Dr. Eranire, who was accompanied on the visit by the Director General of the Nigeria Center for Disease Control, NCDC, Dr. Chikwe Ihekwazu, described the meeting as impromptu, saying he made some clarifications as requested by President Muhammadu Buhari. The presidential villa was reported to have been on partial lockdown after an aide of the president tested positive for COVID-19 and is currently being treated at a secure location, according to the Minister of Health.
Well, it's an impromptu visit. It's unscheduled, and it is to answer a few questions that His Excellency had about the health sector, which we took the opportunity to explain further. We have been able to clarify a few things which were, let us say, in question regarding the state we are in into the coronavirus disease outbreak in Nigeria. Well, I explained those problems, the situation, and what the projection will be going forward, and what are the measures which he think will be very necessary at this time. He wished us very well and told us that we should continue doing the right thing.
Don't forget to hit on the subscribe button and the notification bell so that whenever I upload a video, you will be the first to know. God bless you. Meeting any nephew shouts, who may not from it as 4 bar, Metro Solo. Who can say home sweet home, so I'm trying to make a say if he I had a day.